Good morning, Madam Chair, distinguished members of the committee. My name is Patty Lewis, and I represent Senate District 7 in Kansas City. Thank you so much for the opportunity to present Senate Bill 94, which seeks to protect access to telehealth services for Missourians. The bill has a zero fiscal impact. It is non-controversial, and I would like this bill to be voted out consent should the committee deem it appropriate. The demand for telehealth services has grown in Missouri, and more people are using the services than ever before. Many Missourians lack internet access, and many elderly do not own smartphones or computers. Therefore, telehealth, especially audio-only options, have become a preferred choice among rural and elderly Missourians. So what does Senate Bill 94 do? It cleans up language around telehealth services and does two things. Number one, it protects telehealth services which have been in place since the pandemic with audio, visual, and audio-only options, ensuring that insurance cannot deny coverage. Approximately 20 states have passed laws protecting audio only, including surrounding states like Kentucky and Iowa. The second thing the bill does is allows healthcare providers to select the telehealth platform as long as it's HIPAA compliant, ensuring that insurance cannot mandate what a provider can or cannot choose. Similar states like Oklahoma and Kentucky have adopted similar language. This bill has a history of bipartisan support. Last year, Representative Mike Stevens and I had a hearing in the Health and Mental Health Committee. It was voted out unanimously, 13-0. Last year in this committee, Senator Arthur carried the bill and it passed out 6-0. Both hearings, there were no witnesses in opposition. And just yesterday in the House, the bill was heard, sponsored by a Republican and Democrat. And to my knowledge, there was no opposition in testimony yesterday. So thank you so much for the consideration. And just to recap, this protects telehealth services that have been in place for over 5 years. It is proactive to ensure that if private insurance companies decide they want to reduce or deny reimbursement, our constituents would be protected. So with that, happy to take any questions.